Bismillah ar-Rahman ar-Rahim, my dear students of Ajman University. Today we will start a new topic, chapter 5, which is regarding the evaluation of controlled clinical trial. Now, when I talk about evaluation of controlled clinical trial, I'm talking here about published literature and a type of primary literature in which there is a controlled clinical trial. Controlled means there is the control group, okay, in addition to investigational group or interventional group, and there is the control group. When I say clinical trial, it means we are talking about trials or studies that are done on human, using human subjects. You will see that here we are devoting a whole chapter, and if you look at the pages here, you will see that it's over 100 pages, and that is because controlled clinical trial is the primary evidence used in implementing therapeutic guidelines or changing a therapy. فإذا when a physician or a doctor wants to change a therapy, he should base his new therapy based on evidence. عشان هيك بيحكوا لها, that's why they call it evidence-based medicine. And one of the strongest evidence for therapy, whether to use new drug or to change current drug that is prescribed, using evidence-based medicine, and the strongest evidence, as I said, is the controlled clinical trial. But if a controlled clinical trial is published as primary literature, it doesn't mean that the physician will straight away change the therapy based on that. If he does that without really good evaluation, then the physician might be running into problems with the therapy. So we need someone like you, like pharmacists, who can or who is able to evaluate the controlled clinical trial and make recommendations. Usually physicians, they don't have time for that, and they might rely on impressive results without really evaluating the methodology and everything, and then they just apply the findings on their patients. So that's why you need to be able to evaluate clinical trial and make your recommendation. طيب, what you should be able to do when we finish the whole topic? You should explain the reasons why pharmacists need the skills. 2. One, locate the literature, the required literature, and you learn this in using the secondary databases or the secondary resources. And the second, evaluate the information for pharmaceutical care activities. Yani this is what you're going to learn in today's, and maybe there will be a few other lectures in this topic. So you'll learn how to do the evaluation. You will know how to critique the literature in this regard, regarding controlled clinical trial. فإذا when I say critique, it means you should be able to criticize if there are limitations in the clinical trial literature. If there are some limitations, you should understand them. You should be able to assess the methodology, whether this methodology is used properly or not, etc. Also, you should list the advantages and limitations of biomedical tertiary literature, which you already know, and the continuing education programs. Now, one of the things that happens after you graduate, you may be required to enroll in continuous educational programs. Now, these continuous educational programs can have bias and it can be incomplete as well. So you should be able to describe them and talk about the limitations in this type of literature. Describe the special characteristics of a controlled clinical trial, because there are other trials or there are other studies that are done on human, and controlled clinical trial is one of them, and it's actually a main type of clinical research. But there are other types. You already maybe heard about case control, cohort study, case report, case series. So there are other types of studies that involve human subjects. Okay, so what are the characteristics of controlled clinical trial? List the reasons as to why research results are not published. Yani sometime you will see that there is a clinical trial, and this clinical trial is registered في clinical registry such as clinicaltrials.gov, but even though it's registered, they are not publishing it. Why? Why it's done, it's completed maybe, and it's not published? So you need to tell the reasons for that. Also, you need to give example of websites in which controlled clinical trials need to be registered. Okay, so we need to know such as what, and you already aware of clinicaltrials.gov as one of these registries. Also, you need to inform about the importance of IRB. IRB is the Institutional Review Board, and it's also referred to as Ethics Committee. Okay. You need also to describe the peer review process. What do we mean by peer review? And if you remember, when we talked about professional writing and communication, at that time we talked about peer review process and what's their significance and what does that tell you if there is a peer review for a published literature. You need also to discuss the methods to identify potential bias of investigator. Let's say that there is a published literature of a controlled clinical trial. Is there a conflict of interest with the authors or with the investigators? هل هناك في conflict of interest? Okay. Is there a funding sources that can influence the clinical trial results and its conclusion? We need also to look at that. You need also to discuss the purpose of clinical trial abstract. يعني what's the importance of abstracts? What are the types of abstracts? What are the limitations of abstract? Okay, because because of time constraints, many readers, they tend just to read the abstract and rely on that, and that is not correct. In order to apply the clinical trial methodology, you need to read the whole published trial. Also, you need to discuss or differentiate between internal validity and external validity. يعني when a published trial is there, you need to know whether the results are valid. Okay, هاي بيحكوا لها internal validity. Okay, are they accurate? Are they correct? Have they been carried out in the right way? And then how can I benefit from this clinical trial? بنسموها external validity, applying it into practice. Can I apply it into practice or not? You need also to identify what are the key information that should be presented in each section of a clinical trial published manuscript. So what are the sections in the report or in the manuscript or in the paper that should be listed and described? You need also to differentiate between different types of data. Okay, for example, in a clinical trial you may be measuring cholesterol level. Okay, this is a type of data. Or you may be measuring whether an event is occurring or not. For example, heart attack. For example, you have two groups. One is having the medication and the other one is having the placebo. Well, placebo is something without a drug. Yani there is no drug in the placebo, but it's given to the patients for certain reasons, which we will talk about later. And you are getting some type of data. It can be cholesterol level, it can be an event. Okay, there are different types of data that we will talk about, and we will talk about the measures of central tendency, like the mean, median, mode. We will talk about them as they apply to different types of data, because you cannot just use the mean or average. طبعا the more accurate is mean. You cannot just use mean for any type of data. For example, you cannot say that the average events or average number of heart attack is so and so for the different subjects. Okay, you need to explain the effect of selection bias when you are involving subjects in your trial. Can there be a selection bias? Okay. Also, you need to explain what do we mean by inclusion and exclusion criteria and how we should determine these criteria. You should also explain what do we mean by composite endpoints. What do we mean by that? What do we mean by surrogate endpoints? Okay, and their limitations and their advantages, etc. You need also to discuss the importance of selecting proper intervention, and this is very important, control regimen. Okay, or control drug or control item اللي هو placebo or maybe something else. Also, you need to learn or discuss the importance of determining the right endpoints, how to measure it, and how do we measure this endpoint? How do we determine the sample size in the trial? What is the relation between sample size and study power? What is the accepted study power? And we will learn about some other statistical tests as well. You need to discuss also the need to well define the objective and how randomization is done and whether there is blinding in the clinical trial. You need to explain the purpose of what we call subject informed consent. So anything that you do with human, okay, any research, for example, whether it's interview, questionnaire, or in our case in this topic we are trying a drug maybe with a control, we need to obtain consent from the recruited subjects. Those who we want to try on them these drugs, we need them to agree. We need to tell them about their rights and responsibilities. We also need to explain why, when you want to do a clinical trial or anything related to human subjects, you need IRB approval or Institution Review Board approval or Ethics Committee approval. You need also to tell the reasons for that. You need also to know what we we mean by intention to treat analysis. في عنا two opposing things, intention to treat pair protocol analysis. We have also subgroup analysis. We have what we call interim analysis. So you need to understand what do we mean by each one of them. You need to differentiate between two types of errors that are there when you do the statistical analysis. When you say, for example, drug A is significantly better than drug B, or the effect of drug A on cholesterol levels is more than drug B, and then you give the p-value. So you need here to recognize the errors that can be there and what is the acceptable percentage of error that can be there in such statement. Also, you need to be able to calculate and interpret. يعني say, what does it mean when we say relative risk, when we say relative risk reduction, when we say absolute risk reduction, when we say number needed to treat? What does it mean? Okay, you need to interpret the p-value. If I tell you p-value is 0.5, for example, what does it mean? What do we mean by when we say 95% confidence interval? What do we mean when we say the standard deviation is so and so? What does it mean? What does it mean when we say standard error of the mean, SEM? Also, you need to determine if there is statistical significance between two treatments, if there is a clinical difference. Not every statistical difference is a clinical difference. Also, you need to say whether the results are clinically meaningful. You can end up with a case where there is no difference between the two groups, yet there is a clinical meaningful to the clinical trial results. You need to prepare and understand and describe what do we mean by null hypothesis. Okay, and of course, if you reject null hypothesis, then you are accepting the other hypothesis, they call it research or alternative hypothesis. You need to address the importance of the clinical trial conclusion. في النهاية, at the end of the manuscript, they will say the conclusion. It should be consistent with the results of the clinical trial. Okay, for example, if the clinical trial says, okay, drug A is better than B, so in your conclusion, that's what you are writing, but maybe you need not to generalize this. Maybe you need to describe that it's better with a certain population group, not the whole population. Okay, also you need to explain what is the benefits and the use of editorials. If you remember, we said editorials are not primary literature, and the letters to the editors and the secondary journals. Here, when we say secondary journals, we are referring to journals that publish reviews or review articles, and they are helpful in critiquing clinical trials and in making decisions, okay, regarding the application of the trial results into practice. طيب, طبعا, as you have seen, we have a lot of outcomes, objectives in this topic, and it's one of the longest chapter that we will handle or we will talk about, and you will need to focus on every section because they are built on each other, and you will only be able to answer all the above questions only when you follow all what I described to you until the end. Okay, and I will divide this video to different parts. Now, why we need to continue our expand our knowledge? Why do we need to have lifelong learning? Why? يعني it's not enough what you are studying in your B Pharm degree. It's not enough for you to sustain the knowledge needed and the skills needed, the experience needed for whole your career life. Okay, what you need to do is you need to continue expand your knowledge and maintain lifelong learning. One reason for that is that there are many changes that can happen to medications. For example, maybe there is a new adverse effects, a new type of drug-drug interactions that are written for drugs that in the market. So these are continuously coming up and you need to be aware of them. Not only that, but there are new drugs that come to the market, and these new drugs can change the convention or the way we treat certain disease according to new drugs that come to the market. But anything that is published in literature should not be taken as it is. You should be able to evaluate such information before you can say, okay, I can apply this information. We talked about the advantages and disadvantages of resources, but what about what you see every day, okay, for example over the internet or over textbooks? One good thing about the technology that we have now is that you have access to many resources in electronic formats. But of course there are other disadvantages, such as these resources might have bias, or it might be costly, or there might be some lag time between the information and the current information. Okay, so you need to take this into account. We talked about the need for the pharmacist to respond to lay persons to clarify and explain and defend information. So you need to be able to assess the accuracy of the information before you can do that. You need to be involved maybe in drug formulary plans, maybe with the health insurance as well, to determine which drugs to be included in the insurance plan for certain groups. Regarding the continuous education, now, for example, if you work as a pharmacist in the community pharmacy, they will ask you, the government or the health authority will ask you to do certain continuous education hours every year, and for that you will rely on the presentations that you attend during the year. But this presentation can contain bias, because sometimes the person who's giving the presentation is sponsored by pharmaceutical companies. So it can contain bias, it can contain inaccuracy, and for the textbook it might contain misinterpretation, or the textbook, because of limited space, it might not be comprehensive. So you need to be aware of these things. For biomedical literature, you know that we classified literature to tertiary, secondary, primary, and we talked about each one of them in details in one of the previous chapters. For the primary, the main type of research that is used evidence-based is the controlled clinical trial, because it is one of the strongest study that is used to change therapy. For controlled clinical trials, serves as the foundation for clinical practice. It can change healthcare practices. Not only that, but for any new drug to be marketed, it needs to get approval from FDA. And in order to get approval from FDA, you need, or the company needs, to do clinical trials. طيب, what is this controlled clinical trial? Controlled clinical trial, as I said, it involves interventional group or investigational group, which contains the medicine of interest or the drug of interest, the drug that you want to investigate. And this is compared with a controlled group. يعني we use another group as a control. In this other group, maybe we will use placebo, يعني no therapy, or maybe another standard therapy. The goal of the clinical trial, so okay, we have two groups. What is the goal? The goal of the clinical trial is to see if there is a difference in effect between the two groups. هل في هناك difference? Yes or no? طيب, this difference is positive or negative? This is another thing. فإذا there is a difference or there is no difference. طيب, usually controlled clinical trials are published in a certain standards. It has been known since the 18th century, which means a long time ago. But the standard process of implementing how to conduct controlled clinical trials and how to publish it is relatively it's old, but it's not as old as when we started doing clinical trials. Okay, so in 1940s we started to have a formalized process for conducting clinical trials. Even though there is this process, still we see poorly designed clinical trials that are published. Poorly designed clinical trials that are published. It means that you as a pharmacist need to be able to distinguish poor clinical trials from good quality clinical trials. In order to present the manuscript in a clear manner for the reader, most editors اللي هم the International Committee of Medical Journal Editors, they agreed that any clinical trial report should be published following, between brackets, CONSORT. And CONSORT stands for Consolidated Standards of Reporting Trial. يعني instead of just reporting trial in maybe a non-clear manner, okay, no, there are certain standards or certain sections that you should include in sequence so that the reader can understand and evaluate the controlled clinical trial. طيب, what are these sections? How is it written? طيب, see, طبعا, of course, after the title and the authors, you will start with the abstract. And abstract contains, طبعا, you need to know the sequence here. It contains brief overview of the research project. يعني brief description about the study. Then you should know the sequence and the information in that section. Introduction will contain two main things. It will contain the research background and بين قوسين between brackets rationale, يعني background, why you are doing this, what made you think that this research will be important and it will add new information to others. So research background and rationale, and then, and this is usually at the end of the introduction, you should see the objective. يعني after giving you why they are doing, why يعني this is important to do, Okay, then they will tell you what they're going to do. Okay, after introduction, you will see the methodology section, and in the methodology section they should talk about the study design. And of course, we are talking here about controlled clinical trial, which is one type of study design. We will see what are the other information that should be written under study design. Also, they should talk about patient inclusion and exclusion criteria, which patients can be recruited, which patients cannot, or which subjects that can be recruited and which subjects cannot be recruited. Then they should describe the intervention group and control group. What we mean here, they should talk about what is the medication they want to try for intervention and what they want to put for the control group. Then they should talk about randomization. How do they randomize the subject to the intervention group and the control group? Then they should talk about blinding. For example, are the subjects in the two groups aware of what they are taking, whether placebo or the drug under investigation or under study? Then the endpoints should be given along with how they're going to measure it. Okay, what is the endpoint they want to measure and how they will measure it. Then they should talk about follow-up procedure, how frequently they will follow up with the subject and for how long. Then they should talk about how they calculated the sample size and provide power analysis, what is the power of the study. Then they should talk about the statistical analysis of the data they will obtain, how they're gonna analyze it. طبعا the method should be there before they start their trial. Okay, they should have this plan before they start the trial. Now after they start the trial, they should not deviate from that unless there is something special and they found it, while doing the trial they found something special and they had to do maybe some changes, or maybe they had to add some other type of measurements, etc. But this will be exception, and you will have to carefully evaluate such thing because it was not in the plan. In the results, they should start with subject characteristics at baseline. When they were recruited, the subjects, what were the characteristics of these subjects? For example, what's their age? What's their weight? What diseases do they have? Then they should talk about subject dropout and compliance, because maybe not everyone who get into their clinical trial stay in the clinical trial. Okay, so maybe there is some dropouts or non-compliance, so they have to describe that. And then they should give us numbers regarding the endpoints they measured, along with the analysis. For example, whether this represents significant difference or not. They should talk for the clinical trial about safety assessment, whether there is an adverse effects because of therapy. For discussion, they should take each of all above results, okay, and discuss it and interpret such results. And they will need at this stage also to compare their results with other similar studies. In discussion also, they should provide their limitations. For example, they may say their trial was for 1 year, but it should have been for 3 years. Okay, this is limitation. But be careful here, they should justify why they did not do it for 3 years then. If it is better to do it 3 years, why it's not done for 3 years? In the acknowledgement, those that you cannot put as authors, you can put them in the acknowledgement, okay, after the discussion and maybe conclusion. طبعا after the discussion you might have conclusion, and after conclusion you will have acknowledgement. So you might acknowledge others that cannot be authors, but they have made some kind of help in the study. Also in the acknowledgement, normally you will talk about any funding that is received. Now regarding peer review dates, يعني when the authors send their manuscript to a journal and the editor accepts this manuscript, and then the editor sends the manuscript to a reviewer or reviewers, and then they get feedback from the reviewers, then they will give this the feedback to the authors to do changes, and then again the authors will send the manuscript back to the editor, and so on. Now there are dates for these things, and usually it's provided في المانuscript, usually at the beginning of the manuscript, not in the acknowledgement usually. Okay, now after the acknowledgement you will have what we call references. Usually we call them references, but if you go to Mendeley, for example, or maybe to other softwares, they call them bibliography. Okay, references, any citation you put in the text, whether in the discussion or in the introduction or methodology, you will need to put the whole reference for that under references. Type, this is the format, and I need all of you to memorize that. And in order to memorize it well, you will need to download some controlled clinical trials. And when you download them, look at what do they contain, what are the sections, what is inside each section. Okay, as I said, usually healthcare providers, they base their practice on evidence, and the most robust or the best design to support change in therapy and to provide information regarding any difference in effect between the interventional group and the control group is the controlled clinical trial. But as if you remember the study objectives or this chapter objective, we said, but some clinical trials are not published. So why? The primary reasons for not publishing clinical trial results, one is lack of time. The authors, they don't have time, they are so busy, they don't have time to prepare the manuscript. Or maybe because the clinical trial is incomplete. So why should I publish? I have not completed this clinical trial. Or maybe still it's under preparation or review. No, the author, they want to publish it, but it is still, they are still preparing it. Or maybe they prepared it, but they send it to the editor and they are waiting for the clinical trial results to be reviewed. Or sometimes because the results are not important or negative. Okay, يعني I want to see whether a new drug is better than placebo, and it wasn't better. So why should I publish it? So it will not attract anyone. Or maybe because the study or the quality of the study is poor, so it is not accepted by journals. Or sometimes it's because the authors, they feel that if they send it for publication, it will be rejected, and you know, they don't like such feelings. So there can be different scenarios why clinical trial maybe is not published. But you should be aware that positive studies that contains favorable results are published faster and more than those that contain negative study. يعني if I send an article with negative study, most probably it will be rejected. while if I send it with a positive results معناته most probably it will be accepted and published. So that's why if you look in literature in general, you will see that the majority of published studies are positive. Okay, normally you will expect 50% chance for each one, but when you look at the results or what are published, you will see that most of them have positive results. Now, this can lead to what we call publication bias. So what is publication bias? Publication bias is when there is a negative data. Okay, there is a negative data, so I don't want to include this in my paper, so I'm suppressing some data. Or maybe the journal itself is rejecting a manuscript with negative results, and these will lead to publication bias. An example of that, they have done study on SSRIs, particularly paroxetine اللي هو selective serotonin reuptake inhibitor, which is used for people who have depression. And the investigators actually found that for children there is tendency for them to commit suicide. There is an increased risk of suicide in children. Otherwise, other results are okay. So when they published their study, they did not include this increased risk of suicide in children. The physicians were not aware. They were only aware of positive results from SSRIs. So they were prescribing these agents to patients who are children. And later on, they discovered that, okay, no, there is a problem that the children, there is a danger to the children when such drug is prescribed. Okay, فإذا here we have suppression of negative data. يعني the article is published but without telling anything about increased risk of suicide in children. It's very important, and this is requested by International Committee of Medical Journal Editors, that any clinical trials that will be published in their journals should be registered in a certain registry. It's mandatory. And the purpose of clinical trial registration is to account for research that has been conducted in human subjects. يعني instead maybe different bodies or different agents or different investigators are doing the same thing. No, you register your clinical trial so others can know whether this has been done or is it being done by someone else. So you need to know that. And as I told you, one acceptable registry is clinicaltrials.gov, and this is sponsored by US National Library of Medicine, which is the same that runs PubMed. There is another website also, which is controlled-trials.com. okay, of course I like this one, but you should know that there are other registries as well, not only these two. Another thing you should be aware of, that you should not usually, okay, you should not base your decision on one clinical trial. يعني you find one clinical trial is published without looking at others. Okay, you should make your decision based on all clinical trials done on that topic, on that specific aspect, and then make your decision. Okay, so usually multiple trials are combined together to serve as evidence, and this usually is done in meta-analysis اللي هي a type of systematic reviews إذا بتتذكروا. Meta-analysis, and they consider meta-analysis to be the strongest among all types of studies. ليش؟ because it's actually talking about clinical trial, but not one. It's talking about more than one clinical trial. فبالتالي that's why they have stronger outcomes. يعني the outcomes or the results will be more accurate towards the truth. Okay, as we talked, that usually physician practitioners they will at least partially depend their decision on اللي هو evidence from controlled clinical trial, but they might be influenced also by insurance companies. They might be also influenced by misleading results, study results. يعني okay, they looked at the clinical trial, they found some results, and they said, oh, it's good. So they are applying that without really evaluating the study. And there is another very important thing that you should be aware, that some practitioners, they are easily enticed by gifts. And unfortunately in UAE, you know, the practitioners can be influenced by gifts received from the medical reps اللي هم انتوا. You go to physicians and you tell them, okay, take some medications free for you, or we're gonna invite you to a conference and we'll pay your accommodation, etc., etc. So those physicians or practitioners, they may change their practice because they are receiving gifts, and this is of course not the correct thing to do. And one of my master students is now, she's medical rep, and I asked her to do a study on that. Okay, so she will prepare a questionnaire and distribute them to consultants and specialists in a certain field to see whether this problem اللي هو enticed by gifts اللي هو is it really a big issue in this country. Okay, as I told you, the practice should be based on evidence. طيب, to start with, first you should know that controlled clinical trial studies, they are one type of, between brackets, true experiments. Okay, شو يعني هو في false experiment, true experiment? No, there is no false experiment. No. What is meant here when we say true experiment? True experiment is when the investigator control everything, control the medication that is given, or control the يعني they have different parameters that they control. Okay, they don't just observe. When you observe, as you will see later, okay, when we have the next chapter, inshallah, if you observe, such as in case control study or cohort study, you are observing, you don't interfere with the patients. If you are observing only, this is not true experiment. True experiment is when you control the medication and you control which one to apply. Okay, so controlled clinical trial is a type of true experiment, but it's not the only type of true experiment. There are other types as well, such as stability of compounded drug formulation. For example, I want to see the effect of formulation on the stability of my preparation, مثلا suspension. I might use, for example, antibacterial thickening agent, etc., and see what is the effect of that on the stability. If I am controlling things. Compatibility of intravenous drug admixture. For example, what will happen if I add this to the liquid preparation drug admixture? What will happen? Will there be precipitation? Will it affect the particle size? What will happen? Also to study pharmacokinetic interaction. Will one drug, for example, affects the concentration of the other drug because of interaction? In most of these studies, the common thing is that they are prospective studies. They are considered as prospective studies. يعني all هاي الشغلات, everything, all of these things are prospective. And what do we mean by prospective? It means we are planning it to happen in the future. Okay, يعني for example, I'm planning my experiment to look at the dissolution of drug with two formulation. بدي أشوف, I want to see which one will dissolve faster. Okay, so I'm planning it, and then I'm doing it, and then I'm seeing the results. Okay, في controlled clinical trial we give a drug مثلا للinterventional group or intervention group and placebo to the control group, and then later after giving them we are following them up and we are getting the results. فإتس prospective. عكس البروسبكتيف, the opposite of prospective is retrospective. Retrospective مثلا for example this can be applied في الكيس ستاديز, في الكيس كنترول ستاديز, they are considered as retrospective. فإذا the common things with the true experiments is that they are prospective because I am controlling them, planning them, and then implementing my plan to see the results. In any way, you should assess the study that is published, whether it's controlled clinical trial or anything else, based on several criteria that we will talk about in details inshallah during this lecture and next lectures as well, such as we will look at the qualification of the researchers. Are they expert in the field? Did they use valid method? Did they use the right research technique? Did they do appropriate analysis? Did they interpret the results correctly? طبعا we will do all these things in details. طيب, one important thing to start with. Okay, now we are starting to critiquing, to do criticizing or to evaluate and assess a controlled clinical trial. First of all, look at the journal. Is this journal famous? Is it strong? Does it include peer review process? What about the investigators who are doing the work? So look at them. One essential feature of a journal is whether it has peer review process or not. And peer review process is very important to improve and reduce the poor quality of studies that are published. If it is poor, then usually during the peer review process it will be rejected, it will not be published. If the article has undergone peer review process, then it means that better quality papers are published. Okay, and what do we mean by peer review? Peer review معناته someone who's specialized in that area of research is reviewing your article to say the strength and limitations and the weakness of your study and whether it is suitable for publication or it should be rejected. طبعا in some cases you need to do improvement to your article. Okay, it needs a review, and in some cases it is rejected. Rarely you will see that a paper is published without any comments and everything is good, unless we are talking about a low quality journal. So in most cases what will happen is that you will see that the reviewers are asking you to make changes and revise your manuscript. طبعا there are different types of peer review. For example, we have the most common اللي هو single blinded review process, meaning that the authors of the manuscript, they don't know who's reviewing their paper, but the reviewers they know about that. بسموها single blinded review process. Okay, single blinded peer review process. طيب, few times they have what we call double blinded peer review process, in which the authors or the investigators of the manuscript are not aware of the reviewer identity, and the reviewer is also not aware of the author's identity. So both of them are not aware of each other. We call it double blinded peer review process. طيب, how do I know if the journal is a peer reviewed journal or not? Well, if you go to the طبعا there are two places where you can check whether it's peer reviewed or not. One is in the journal scope or purpose, يعني في الانtroduction, يعني on the website, the home website of the journal, they will tell you, okay, this journal is a peer reviewed journal which is published bi-monthly, etc. So in the scope or the purpose of the journal, and also in the instructions for authors or guide for authors, also you can find such information. Is there non-peer reviewed journal? Yes, but these are mainly commercial, and their aim is to generate profit. And how you will know that? You will see that they have a lot of advertisement in the magazine or in the journal, and even sometimes the author may have to pay money for each page in which the report is published. يعني for example, if you send a report or a manuscript, they will tell you, okay, this will take 5 pages, I need from you مثلا $1,000 for example. Okay, so طبعا of course, regardless whether the clinical trial is published in peer-reviewed journals or not, you will still need to evaluate and assess the papers or the manuscript well, because even with peer-reviewed journals you might have poor clinical studies, and with non-peer-reviewed journals you might have some good studies. Now, regarding the journals, and let me talk about this in more details than what you have in the notes. There are some journals that are very well known. Okay, they are top journals. They are considered of high quality journals, and they tend to publish high quality study. But even then, you will still need to assess the manuscript in such journal. One example اللي هو New England Journal of Medicine. Okay, and we have Annals of Internal Medicine, and such journal. في عندنا كمان JAMA. We have JAMA, Journal of the American Medical Association. These journals are very strong, and let me just show you here. If I go to Scopus, I want to show you how strong these journals are in the field. Okay, this is the New England Journal of Medicine. If I click on it, شوفوا what you see here. It's 99%, which means it's number among the top. Okay, top هو 99%. هذا التوب. فإتس among the top journals, and في general medicine it's number 2. الرانك تاعها number 2 between or among 529 journals. Let me go to the other one. Annals of Internal Medicine. Okay, see, it's 97% among the top 10%, actually among the top 5%, and it's number 4 among 128 journals في internal medicine. Let me see Journal of the American Journal of the American Medical Okay, this one, Journal of the American Medical Association. Okay, let's look at it. Let me just remove this. Okay, see, if general medicine is number 4 among 529. For these are very well-known journal, and that's why you will find, actually, if you take paper from these journals, you will find that most of these papers are of very good quality. The methodology is very clear, very well organized, etc., etc. But even then, as I told you, you still need to evaluate such studies. Another important thing regarding the journal, and to know whether it has it's a good journal or not, is to look at what we call impact factor. Okay, factor. Okay, what is impact factor? طيب, let me tell you the following. Let's say I want the impact factor for, طبعا I cannot have now for 2021 because it has to end. Okay, and maybe after some time, after ending 2021 and waiting for some time, maybe a few months, 4 to 6 months, then we will know the impact factor of 2021. So what we can know now is 2020. So how do they do it? Type, suppose this journal, let's say JAMA, okay, just this is an example. Let's say JAMA in 2018 they published مثلا 1000 articles, وب 2019 they published also 1000 articles. This is just an example. Okay, now in 2000 طبعا this is in the journal اللي هو JAMA, let's say. Okay, طيب, in all journals, طبعا approved journals by Clarivate Analytics, all journals in 2020 they referred to these papers اللي هي published in JAMA 2018 and 2019. They refer to it مثلا 500,000 times. Okay, يعني they cited البيبرز اللي published 2018 و 19 في JAMA, they cited it 500,000 times. Okay, طبعا I put this large number because this journal is very strong. Okay, so how do they calculate the impact factor for JAMA 2020? They look at how many citations in 2020. Okay, and then they divide that by the number of publication in JAMA في 2018 plus 2019. Okay, in order to calculate that, so we'll write how many times in 2020 they referred to JAMA. They referred 500,000 times. Let me put here comma just to make it more visible. Divided by how many articles published, 1000 1000, so divided by 2000. Okay, so if we do the calculator, we'll say 500,000 divided by 2000, and it's equal to 250. طبعا this is very large number. If I consider this, let me say 50,000 rather than 500,000. 50,000, 50,000, and here I will say 50,000. Recalculate, we'll see what is the results. 50,000 divided by 2000, it's equal to 25. Okay, طبعا, which is considered a large number, but let's really find out what is the real impact factor of JAMA. Okay, let me just write here JAMA impact factor. شوفوا 45.5. okay, طب شوفوا لنيو انجلاند Journal of Medicine. شوفوا قديش 74.699 and 74.7. so this will tell you about also the strength of the journals. You should be aware of that. طيب, when they publish articles, sometimes there is one type of publication, they call it meeting abstracts. Maybe you are aware of DUFAT posters and talks. So if you want to participate in DUFAT, they will ask you to send them the abstract of your work, and then this abstract they will publish it in a magazine. Now, although meeting abstracts are reviewed, but the review is not done thoroughly. Especially, you need to know that not the whole study is there, just the abstract. So even if they want to do a thorough review, they will not be able to do that because not all the details are available. Another type of publication is in journal supplements. What does it mean? Consider a journal that has 12 issues per year, يعني every month there is an issue, but sometimes they will publish, they will decide to publish a supplement, يعني additional issue, we call it supplement, and this supplement will be usually about certain topic, and in several cases a company will sponsor the supplement. يعني for example Novartis or Pfizer, they will say okay, we want to publish in a certain topic, specific topic, and it has to be about so and so, and we will pay money for its publication. Now, although some supplements they will provide good quality studies, but because some supplements are supported by pharmaceutical companies, they may have low quality low quality publication, especially that the review process is not really rigorous as the normal issues, يعني مش very strong as in normal issues. So you should be aware of that. Also, you should look at the investigators' credentials. Are they qualified? هل investigators they are of good position and experts in their field to be able to do the work? هل the practice site, okay, is qualified? Do they have the equipment, the staff, everything to do the study? Is it qualified? Although these are important things, but not every a study that has good practice site, يعني Harvard or something like that, or a big hospital, it means that the study will be of good quality. But what you need to assess and investigate is whether the site is qualified. The site, is it qualified? Does it have the necessary equipment, staff to do a good quality study or not? That's what you have to do. Also, you need to be aware, especially with large clinical trials, they have to involve a specialized person who's aware, يعني has credential in biostatistics, because it will contain complex analysis, and someone who's specialized with biostatistics is important. That's why, if you remember, when we talked about professional writing and communication, we said that you will need to have some skills in biostatistics. Okay. Also, the authors that are listed, if you remember, for professional writing and communication, they should have substantial contribution to the publication. Okay, an author is generally considered to be someone who has made a substantive intellectual contribution to a published study. You should selectively be careful regarding bias when employees of pharmaceutical company are publishing studies. You should selectively analyze their study better, because there is conflict of interest. يعني the company wants money, wants to generate profit, okay, while the study is done for the sake of patients and their well-being. So there can be a conflict of interest, and journals will ask the authors to declare if there is any conflict of interest. Now someone will say, okay, yes, I'm getting some money from the pharmaceutical company, but I don't, what I write is correct. I don't have conflict of interest. Even if you think that your judgment is not affected by the money you receive from the pharmaceutical companies, you should declare that. You should declare that you are receiving money, or you have been at one stage speaker for the company or promoting their products. All of these things you should declare them. Of course, you know that most studies are sponsored by pharmaceutical companies, and we cannot just say all of them are worthless because there is a conflict of interest. Conflict of interest is just something that rises flag for you to be aware that there can be something misjudged, or there is misinterpretation or misleading. That's all. But you have to do the evaluation and make sure that the study is actually of good quality and non-biased. Even in the academia, if you go to universities, especially in USA, they require faculty, يعني professors, they require them in their university to get grants and funds from pharmaceutical companies in order to do their investigations and their research. So if, for example, I get sponsorship from Gelfar or from a pharmaceutical company to do my investigation, okay, it doesn't mean that there is a clear bias, okay, especially if I am not only taking funds from one company all the time, I'm taking only from Gelfar. No, there are many other companies who are sponsoring my work. So when I'm getting funds from so many different companies, it means they are doing that because I'm active in the field and they want to have their drugs investigated. But if I'm always taking money just from one company, then there is a question mark. Do they own me? Do they pay me a lot of money just to present results that agree with them. So all these things you should take it into account. طيب, so after we talked about the journals, the investigators, the practice sites, the peer review process, now we want to talk about the clinical trial title. Okay, it's very important that the title should be specific. Okay, يعني specific ايش? It talks, يعني when you read the title you know what it is talking about exactly. It should be unbiased. Unbiased يعني I should not say, for example, a miracle has appeared. لما أول ما حكيت the first thing I said miracle, it means there is a bias. Okay, it should be concise. يعني as short as possible, usually not more than 10 words, even though some studies will have more than that. You should avoid declarative sentences, and in the trial it's better to add so that people can recognize what is the type of study just from the title. It's better to add to the title randomized clinical trial. Okay, for example, see here, effect of 1 or 2 doses of inclisiran, this is a new drug, on low density lipoprotein cholesterol levels, 1 year follow-up of the Orion 1 randomized clinical trial. طبعا you will see here that it's registered in clinicaltrials.gov. okay, and see, it's not declarative. It's say what effect of, what is the effect. It doesn't tell you improved مثلا or excellent or whatever. It doesn't say that. It's not declarative, and they are mentioning a randomized clinical trial as well. طيب, I want you to see the following so that you understand what do I mean by bias. Okay, شوفوا البايس في the following title. See this title: improved bronchodilation with levalbuterol compared to racemic albuterol in patients with asthma. هلا شو بفهم؟ improved bronchodilation يعني there is a better bronchodilation when you use levalbuterol compared with racemic albuterol. Racemic يعني when it has leva and dexa. okay, أو left and right. okay, racemic يعني يحتوي, it contains both orientation of albuterol in patient with asthma. يعني the condition is asthma. طبعا it doesn't say controlled clinical trial here, but it suggests to the reader that there is improvement in bronchodilation when you use levoalbuterol. But see, when you read what is inside, see, the title implies levalbuterol to be better than racemic albuterol. Although the average change in the lung function parameter was slightly greater. طبعا يعني بحكي لكم انه lung function was little better with levalbuterol, no significant differences were reported. ما كانت difference significant, so I cannot say that they are significantly different. I cannot say this. okay, so I cannot say improved. okay, thus one could have been misled by the title. Suggested, شوفوا suggested bronchodilation from levalbuterol compared with racemic albuterol in patients with asthma, a randomized clinical trial. okay, this sounds better. Now the second thing we need to assess is the abstract. The abstract is summary of the study of the project. Summary: what is the objective, what is the rationale, what is the method, what are the results, what is the discussion, etc., conclusion. So it talks about summary of all these things, and it's very helpful for the reader to determine if the entire article should be read. Do I need, okay, I will read the abstract. If I like the article, it's related to what I'm searching for or what I want, then I will read the whole article. Also, you should know that abstracts are also used by secondary resources زي PubMed والIPA اللي هو International Pharmaceutical Abstracts, and that is to help in conducting literature searches. There are two types of abstracts. One is the structured abstract and non-structured. إذن we have two types, structured and non-structured. شو يعني structured? Let me go to the example I was talking about here. شوفوا, this is the abstract and it's structured. Importance, يعني it contains subheadings: importance, objective, design settings and setting and participants, intervention, main outcome measures, results, and conclusion and relevance. طبعا these subsections can be different from journal to another journal, but what I mean to say here is that it is structured, يعني has headings. And usually, okay, let me take this, copy it, just copy it. Okay, I want to copy it to Words, to Microsoft Words. Okay, usually it takes longer space, and usually the number of words are larger than non-structured, okay, because you have to put different things. For example, see the number of words here. If I go to reviews and then I click on word count, see there is 380. Okay, usually it takes more space compared to non-structured. Non-structured will contain elements of these things, but maybe with less details. طبعا for the reader it is helpful to have structured abstract because you can go directly to the item that you like, and usually it contains little more information than non-structured. From journals' point of view, they are concerned about the space because they pay money for the space. So maybe the journal prefers non-structured because of the space, but the readers, they like the structured. And normally, see here, it contains less than 500 words. Actually, in most cases it should be less than 300 words. هذا الابstract. Okay, now the thing is, can I just, since the abstract contains summary of the work, why don't I just rely on abstract? طبعا this is wrong. Actually, there were many studies done, including in very high quality journals, okay, and they found that many abstracts, large percentage of abstracts, contain omissions and discrepancies. يعني في حذف for some of important things, okay, that is decisive when you want to do decision, okay, but they have not included it in the abstract, but it's very important for you to make decision. Also, they found differences between the abstract and the rest of the manuscript. Discrepancies, يعني numbers here are different from the manuscript. In the abstract the numbers are different, etc. طبعا this can happen at different stage of preparing manuscript. For example, you might write the abstract first, and then you start writing the manuscript, بعدين you are forgetting to update your abstract, or maybe you have sent your manuscript to the journal, and the reviewers, they asked you to do different types of analysis, and then you forgot to update الابstract. So there can be many reasons for that. That's why you should not only rely on the title and abstract. Okay. For introduction, if you remember, we said that there are two main things that should be in the introduction. One is the rationale. Rationale يعني why you want to make this clinical trial. So you give background about the topic usually, and then you point out that such study is needed and it has not been done before. This is very important. Such study is needed to answer certain question, and this study has not been done before. Okay. And at the end you will provide the purpose. And let me talk here about the objective or the purpose. Although this is not in all clinical trials, in some of them, but there will be objective for the trial in the form of null hypothesis and alternative hypothesis. Isn't what I mean to say, not all clinical trials will contain null hypothesis and alternative or research hypothesis. Not all of them, some of them. Okay, depending on the type of study. لأنه بيعتمد. Sometimes you want to look at mechanism which is not related maybe to null and research hypothesis. فإذا some of them might include these two. طيب what does it mean? شوفوا. It means, okay, let me just put it for you here. You are, let's say, have the intervention group, and the intervention group is taking drug A. Okay, and then you have the control group who's taking maybe drug B or placebo. Okay, طيب. And at the end, you want to see if A is different from B. Is it different in effect or not? See, if A minus B is equal to 0, it means there is no difference, صح? And this is the null hypothesis. But if A minus B is equal to 1, it means there is a difference. فإذا in null hypothesis, طبعا it's not taking, طبعا this is just to make you understand what is null and what is H1. So null hypothesis means there is no difference between the intervention group and the control group بالeffect of the drug. ما في difference. Research hypothesis says that there is a difference between the research or the intervention group and the control group. طبعا it doesn't mean the difference is 1, but it means that there is a difference. Okay, طيب. Now they might not really put it as clear as I'm telling you. Okay, so it depends on the study you're looking at. Okay, and here you will have an example. Okay, شوفوا مثلا one of the very famous controlled clinical trial is referred to as Women Health Initiative. شوفوا, I will show you now. واحد, شو الراشينيل في الانترودكشن كان? What is the rationale? Number 2, what is H1 and H0 hypothesis? شوفوا, طبعا this Women Health Initiative it was carried out على healthy post-menopausal women, الwomen after menopause. Okay, بس healthy يعني otherwise healthy, they are healthy, بس بعد ما صار عندهم المينوبوز. post-menopausal women. WHI trial اللي هو Women Health Initiative compared conjugated equine estrogen يعني الاستروجين مع with يعني combination together مع البروجسترون. These two combination اللي هو استروجين مع progesterone, they want to give it to healthy post-menopausal women and see whether it has beneficial effects or not. طيب هلا I'm just telling you about the trial in general. شوفوا في الانترودكشن شو كتب. The investigators expressed in the introduction section that the rationale for conducting this clinical trial was the lack of human controlled clinical trial. يعني ما في كان هناك controlled clinical trial before this. This is a new thing. طيب وبتعرفوا انتوا ال controlled clinical trial is the best evidence to answer ايش؟ To answer if the drug has an effect or not and how much is this effect. انتبهوا, the best or the only clinical study that can answer the question whether the drug has an effect and how much is this effect اللي هو ال controlled clinical trial. طيب شو حكوا؟ حكوا prior evaluation, يعني كان في هناك دراسات بس it was mainly observational not true experiment. observational زي الكوهورت او الكيس study. وهي observational study reported reduction in adverse events. يعني adverse events زي coronary heart diseases والهيب fracture قلت عند النساء البوست مينوبوزال, قلت, بس كانت observational والobservational is not strong enough, but it can be used as reason for doing controlled clinical trial. حافز لعمل controlled clinical trial. طيب في الobservational برضو شافوا there are changes in clinical parameters such as decreased lipid levels وincrease بالbone density, and these two parameters they support انه في هناك reduction بالcoronary heart disease وبالهيب fracture. فحكوا طيب خلينا نثبت هلا how do we provide evidence. وشوفوا شو حكى الاوبجكتيف هي عشان تحكوا لي ال H1 وال H0 to directly address whether estrogen plus progestin has a favorable or unfavorable effect on coronary heart disease incidence and on overall risk and benefit in predominantly healthy women. طيب طبعا he's comparing it with what؟ يعني قارن هدول الكومبينيشن مع ايش؟ مع البلاسيبو. اوكي اذا في عندنا جروب بلاسيبو وعندنا جروب في الكومبينيشن اوف هرمونز. اوكي طيب شو اللي بده يشوفه؟ he wants to see or they want to see whether this combination will make a difference في coronary heart disease ولا it will not make difference. okay طيب if it will not make difference so H0 no difference. يعني شو الهايبوثيسيس تاع H0؟ you should say the following: estrogen plus progesterone is not different from placebo. This is what H0 is. In state H0 or null hypothesis, estrogen plus progesterone has or is not different from placebo in ايش؟ في الeffect on coronary heart diseases. طيب state H1 شوفوا ما حكى لكم H1 و H0. The authors did not say anything about H1 و H0 but he gave a statement. From the statement you should know. طيب شوفوا ال H0 sorry ال H1. ال H1 is there is a difference in effect on coronary heart disease between the group taking estrogen plus progestin and the group taking placebo. هلا هذا الديفرنس كان بي ايش؟ favorable يعني كويس or unfavorable يعني سيء but it's different على اي حال. اذا شو ال H0؟ H0 is the statement حطوها progesterone plus estrogen is no different from placebo في ال effect of on coronary heart disease incidence. طيب H1 اللي هو estrogen plus progesterone is different from placebo على الeffect on coronary heart disease incidence. طب difference شو يعني better or worse؟ it can be any one of them. المهم different. اوكي طيب بس هو حكى كمان on and on over all risks and benefits. يعني معناته هو كمان بده يشوف بشكل عام الهيب fracture و other things. إذا also again you say H0 estrogen plus progesterone is not different from placebo على الeffect on overall risk and benefits in predominantly healthy women. طبعا هذا البوبوليشن الومن اللي هو post menopausal healthy women. طيب شو ال H1 انه progestin plus estrogen they have or they are different from placebo في ال effect on overall risk and benefits in predominantly healthy women. اوكي خلونا نيجي هون مثال اخر. طبعا here you can see the objective. okay you can read it but you can get more detailed objective بالmethodology وبنهاية الانtroduction. في الانtroduction is very important. okay so if you click, this is a free one, JAMA Cardiology. If you click on the article, this is what you will get. And if we go to the introduction, the last C here, شوفي دائما على السريع. This is what makes you different from others, is that you know where the location of the objective will be. It will be at the end of introduction. At the end of introduction. Yes, you will get it in the abstract, but in the end of the introduction it will give you more details. شوفوا هون. The objective of this pre-specified analysis was to describe شوفوا هون describe the mean reduction in LDL-C exposure over 1 year achievable with single dose or 2 dose regimen من الانكليزيران. اوكي هذا new injections بيشتغل عن طريق ال RNA. It's very efficient drug. They want to give it once a year or twice a year and see what's the difference between that. okay the within individual variability in LDL and the persistence of the therapeutic effect at year 1 as well as overall safety. طبعا عنده many. طبعا هو حطه بوبجكتيف واحد but it has many يعني sub objectives but mainly شوفوا هون he's giving 2 dose regimen من انسليزيران ومعطي single dose وبده يشوف ل 1 year شو بصير. اوكي طبعا في الميثودز you can get more information about his objective. yes more specific information but let me just give you one of the objective here and try to see if we can get H0 and H1. ماشي. أول شيء is using single dose once a year or 2 dose regimen يعني twice a year and looking at LDL exposure over 1 year. okay so he wants to look at what happens to cholesterol level over 1 year after giving either 1 dose or 2 doses of the RNA drug, the drug that can affect RNA to reduce cholesterol level. More information about the treatments are here. شوفوا patients were randomly assigned to a single dose هذا في الميثود of inclisiran sodium 200 300 or 500 هذا 1 dose من الدي 1 or 2 doses من inclisiran sodium يا اما 100 200 and 300. اوكي شوفوا ال1 دوز اكبر هي، بس هنا عشان 2 doses so each dose يعني together they will be equal or maybe more than this one. طيب ال2 doses راح ينعطوا في day 1 وبعدين after at day 90 راح ينعطوا للجروب الثاني. بس هنا كمان اوكي راح تلاحظوا في انفورميشن زياده كاتب لكم بلاسيبو. اذا هو راح يعطي بلاسيبو في داي 1 زي ما راح يعطي، يعني في عندنا 3 جروبس، جروب او اكثر سوري، في عندنا جروب راح ياخذ بلاسيبو في داي 1، جروب will take 200 ملي جرام في داي 1، جروب will take 300 ملي جرام في داي 1، جروب will take 500 ملي جرام في day 1، جروب will take 100 في day number 1 وايش 100 في day number 90، جروب will take 200 في day number 1 و200 في day number 90، جروب will take 300 في day number 1 and 300 في day number 90. اوكي طبعا I just want to simplify things here because it's not very clear. So they want to see which one is better in controlling the cholesterol level. So I can put the H0 hypothesis when I شوفوا هنا when I compare 1 dose to 2 doses. I can say for example H0 hypothesis is that 2 doses of inclisiran sodium is not, طبعا I have to specify which dose I'm talking about in both cases, is not significantly different from 1 dose of inclisiran sodium. طيب شوفوا الالترناتيف اللي هي الريسيرش هايبوثيسيس، نحكي انه 1 dose، طبعا I have to specify which dose of 200 مثلا milligram of inclisiran sodium is significant for reducing on the effect on reducing cholesterol level is significantly different. هلا significantly different it can be better or worse, is significantly different from 2 doses بين قوسين ممكن احكي 100 ملغ of inclisiran sodium given twice a year at day 1 and at day 90. Okay, you can practice such thing, and if you have any question you can always ask me to get a better idea. Okay, you have to be ايش؟ طب how do I how do I assess or evaluate the introduction? You need to know that authors they tend to set the stage، يجهزوا المسرح، the theater. Okay, when they want to prepare the theater, okay, in order for people to present something. So at the same way they might take you with them so that you think that their work is unique. You know, they have something in you. Yes, they have right, but actually they have not made a comprehensive search, and their search was weak or it was based on weak references. فبالتالي the work that they intend to do is not important because it was done before, but they have not really carried out a good search, or they have twisted the words. They used biased wording to show you, predisposes that that in order for you to believe that previous researches were not significant. And that's what they want to do. They want to provide you with the best answer by doing this research. Okay, we'll talk a little bit about methods. We will not cover everything today, but in methods it's very important, if you remember, to talk about the design, the inclusion exclusion criteria, the intervention and control group, the endpoints, our outcome measures, sample size and power analysis, statistical analysis. These are to be provided in the method. I want you to know that the method section should take most of your time, and it is the most important part of the study. تخيلوا, method is very important. You should spend a lot of time just assessing the methods. You know, for example, if you want to build a villa or you want to build a house, one important thing, whether in UAE, Syria, Egypt, Jordan, etc., Iraq, in order to get approval from the municipality, you will need to provide them first with approved plan. We call them blueprint, plan for the house. Then after their approval, then you can start building your villa. Okay, now the method section is just like that. If the method has flaws, إذا كان في الميثود فيه flaws, معناته everything will be affected. Okay, or at least the parts that contain flaws في المethod will be affected, and this will affect the internal validity and the external study validity. So what do we mean by internal validity? If my design is good, it's of good, the quality is good, I'm doing the right analysis, etc., then this will lead to good internal validity. Strong design should translate into reliable results. إذن results that you get is good because you have done good-ish design. Okay, طيب, if you have good design, can you have external validity? Yes or no? Okay, it can be yes or it can be no. If the study results are meaningful to practitioners, يعني the practitioners can now apply this or the study, apply the study to their patients for improving their health, then it's meaningful, then you have external validity. If the results is saying no, the new medication is bad or the new drug is bad, is not giving, it has a lot of safety concerns مثلا, okay, even though it has good internal validity, يعني it was designed well, but it shows you that the drug has no effect or it has a lot of safety concern, فبالتالي you may not apply it externally, وبالتالي it doesn't have external validity. Okay, but if it has good internal validity, okay, then and it can be applied into practice by the practitioners, then it has good external validity. Okay, so you should be aware of that. طيب, if there is flaws in the design and you don't have good internal validity, maybe some of the results will be good and you can take them depending on the design, and some of them you will not accept them because there is flaw in their design. Okay, so you need to take this from different perspective. As I said, the method will be provided in a standardized way. It will start with the study design, and let's talk now about the study design. طبعا the study design will start saying that this is a controlled clinical trial. هذا study design. It's a multi-center. هذا study design. Randomized. هذا study design. Part of the study design. The main study design له controlled clinical trial. when I say it's placebo controlled or multi-center, يعني it happened in different centers in the United States or in the world, then I'm talking here about something that is part of the design. Okay, let me just go here to see what is the design. شوفوا هون بالميثود، شوف شو مكتوب: the design لهذا الترايل has been reported previously. هذا الترايل was، شوفوا، randomized, double blind, placebo controlled phase 2 clinical trial to evaluate the safety and efficacy and tolerability of different doses of انزليزيران. اوكي، شوفوا هذا ديزاين هذا. اوكي، طيب نرجع. let us get back. طيب طبعا we are talking about controlled clinical trial. بس I want you to know, yes, controlled clinical trial is the best evidence, is the best thing to prove effect. And how much is the effect? The magnitude of the effect. يعني to establish relationship, effect, and how much, and the magnitude. اللي هو controlled clinical trial. It's the strongest evidence. But sometimes, even though this is the design that will answer the question, I will not ethically be able to carry out the study. شوفوا مثلا, let's say there are indications that there might be a pharmacokinetic interaction between azithromycin, يعني they can affect the concentration of each other, azithromycin as antibiotic and cyclosporine. طيب, maybe there is. So you want to assess, is there, will azithromycin affect the concentration of cyclosporine? Will it do that? طبعا شو هنا ال H1 انه azithromycin can change the concentration of cyclosporines. يعني اذا في هناك change في الcyclosporine concentration, or azithromycin did not change, يعني there is no change في cyclosporine concentration. Let me just tell you a little bit about these two drugs. هذا azithromycin is antibiotic. Cyclosporine is given في اللي هي when planting kidneys, اللي هو grafts, etc. So you know when they replace a kidney, the body can reject the kidney. So in order for the body not to reject the kidney, they will administer cyclosporine. The problem, cyclosporine will reduce body immunity. Okay, طيب, which means the person can have infection. Azithromycin is antibiotic that can fight infection. So can azithromycin affect cyclosporine concentration? If it doesn't, then it's good. But if it affects, it can increase it ويصير عندنا toxicity, or reduce it ويصير عندنا ايش؟ rejection للكدني. طيب, can I do, طبعا the best way to answer this is to do controlled clinical trial, but ethically can I do that? If azithromycin will affect cyclosporine concentration, this can lead to toxicity or rejection of the organ. But it's not ethical to do that. Okay, so sometimes, even though the best design is controlled clinical trial to answer the question, ethically you cannot do that. For example, I'll give you another example which I always tell my students. Very long time ago, they used to say that smoking may cause cancer and cardiovascular problems. Okay, and of course many people who smoke cigarettes, they used to have cancer and coronary disease, heart disease, etc. So they were asking the cigarette manufacturing companies to compensate them because they were affected from the cigarettes that these manufacturers are manufacturing. Okay, فinitially شو كان يصير؟ The companies used to say no, there is no strong evidence that cigarettes will cause these problems because all the evidence that are there are observational. They are observational. طيب observational يعني it's not the strongest evidence, it's weaker evidence. So in order to prove that, what you need to do is recruit subjects, make them into groups, let one group smoke cigarettes and the other group should not smoke cigarettes, and then see the difference. Will this, after 30 years, we will get, for example, more cancer in the group smoking cigarettes? But this is not ethical. Okay, not ethical to do. That's why the cigarettes manufacturing companies were utilizing the type of evidence that is provided to the court to defend themselves. طبعا later on, because they discovered the mechanism, etc., etc., now it's very clear that cigarettes can cause all these problems. Okay. طيب, important characteristic of design, as I told you previously, it's prospective in nature. يعني you plan and then you measure ahead later on. Okay. It's not something already measured and you just observe it. You just take the data, or you observe what is happening without interference. No, you plan and then you apply and then you start measuring. Also, you need to know that this controlled clinical trial is referred to as parallel design. Parallel design, because I have two groups. Two groups. طبعا parallel is opposite to crossover. Crossover لما يكون عندي just one group and I'm giving them drug A. After drug A, I'm just stopping for some time and then I'm giving them, the same people, I'm giving them drug B. هيك صار على same group, they call it crossover. بينما parallel is talking about two different groups. Okay, each one is given a different treatment. Controlled clinical trial, as I told you, it's the most rigorous method in establishing cause and effect relationship. One, is there an effect? How much is effect? The magnitude of effect. Example, atorvastatin, which is medication used to reduce cholesterol level, اللي هو LDL-C, اللي هو lipoprotein, low density lipoprotein cholesterol, which is dangerous. They compare it with placebo. Okay, what they said, the study objective was to compare the atorvastatin, okay, اللي هو الcause, to placebo and measure the reduction in the average LDL-C levels, okay, between the two groups. مين بيحكي لي? Who can tell me what is H1, H0? H0 is there is no difference between atorvastatin and placebo in the effect of the level of cholesterol. Okay, على الكوليسترول level. H1 is there is a significant difference between atorvastatin and placebo on cholesterol level. هذا هو H1. هلا طبعا شو significant difference, higher lower, this is another case. But both of them are considered as H1, whether higher or lower. إنه في difference. A clinical trial also quantify the differences in the effects, such as atorvastatin compared to simvastatin. Both are from the same class. I can compare them and see which one is better in lowering also cholesterol level. Okay. طيب, we'll stop here. Just before stopping, just last part. طبعا see, if I say, okay, if I find that atorvastatin is better than placebo. It reduces cholesterol. I have two problems here that you should know. First is that it tells me that it's better than placebo, but it doesn't tell me whether it's better than other similar drugs in the market. Is it better, for example, than simvastatin? I don't know. Okay, this is number one. So if it is in the market, I cannot go and convince doctors and prescribers or practitioners to prescribe atorvastatin rather than the simvastatin or rovastatin, unless you do a comparison between atorvastatin and the best that is available in the market. Okay, if atorvastatin is better than the best available in the market, then I can convince physicians and practitioners to change the therapy. شوفوا إذن such trials can serve as a source of evidence to determine treatment plans. إذن if I compare it to placebo and it's better than placebo, I cannot convince practitioners to prescribe it just because it's better than placebo. If it is better than the best in the market, then I can convince them to change the treatment plans for the patients. Inshallah, in next week we will talk about patient inclusion and exclusion criteria. I hope you benefited from today's lecture. If you have any question, you can ask me in normal ways in the class or in the WhatsApp group or in the or by sending an email. So there are different ways for you to ask me questions. Take care and have a nice day.